Good morning. Good morning and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesdays. My name is Shayla Zimmerman, and today we're going to talk about the importance of talking with young children and how to build vocabulary and early literacy with LENA START. As a reminder, please put your questions for our guest speaker in the chat box on Zoom or into the comment section if you're watching on Facebook. We are joined today by Dr. Teresa Holtrop, a board-certified pediatrician and executive and medical director of Kids Health Connections. Kids Health Connections is a nonprofit organization that seeks to help medical practices serving Medicaid-enrolled children to improve the quality of care they provide. Dr. Holtrop is a Michigan native. She completed medical school at Michigan State University and her pediatric residency at Children's Hospital of Michigan in Detroit. After completing a 4-year National Health Service Corps commitment at a federally qualified health center in Detroit, she worked for 24 years as faculty at the Children's Hospital of Michigan General Pediatric Clinic, as well as founding and running the Catch Pediatric Mobile Team. She's passionate about understanding the link between improved early literacy and positive health outcomes, as well as identifying and implementing effective interventions that promote emerging literacy and health. Thank you so much for joining us today, Dr. Holtrop. We're so excited to hear more about Kids Health Connections and early literacy.
Thank you so much for having me. I'm really delighted to be able to present on this. Could I have the first slide, please? And the next one, thank you. So LENA START is a program that is a joint project of Brilliant Detroit, many of you may know of that organization, and Black Family Development Incorporated, as well as my organization, Kids Health Connections. Next slide. LENA START is a response to research that came out in the 1990s that is oftentimes referenced as the research on the 30 million word gap. And basically what it involved was looking at how the interactions were, and it was very laborious at the time because of the technology limitations that existed then, of videotaping interactions between parents and children in their homes, and then looking to see how many words were actually the children actually heard. And what they discovered was that the children, by the time they got to their 4th birthday, if they were from lower or middle income families, they tended to have heard 30 million less words than kids from upper income family or college educated families. And it has nothing to do with the income. It has to do with how stressed are you? How much do you know about the importance of speaking to your children? So next slide, please. The importance of this is because of what is happening in the brain in the early years of life. In those first few years, we typically think of the first 5 years as the most important, but I want you to take a look at these slides. On the left-hand side, you see a slice of the brain and a microscopic picture of the amount of connections that are present at birth. And you see there are brain cells. That's sort of the base of where all these little dendrites and axons come off of. And you can see that there are connections, but there aren't nearly as many connections as there are when you look at a 14-year-old's brain, which is on the right-hand side here. And it's not like there are more brain cells, it's just that there are more connections there between, that somehow happen between birth and 14 years of age. Now, I want you to stop and think for a minute, what does a 5 to 6-year-old's brain look like? Is it more than the 14-year-old's brain? Is it less than the 14-year-old's brain? Where do you think it is? Okay, I've given you a few seconds to think about it. Let's go to the next slide. Next slide, please. Thank you. And you can see here that a 6-year-old's brain actually has a ton more connections than the 14-year-old's brain. So what is happening here? It turns out that The brain, through a number of genetic and environmental stimuli, the brain puts out connections like crazy in those first few years of life. And we see that within, parents notice it, physicians certainly notice it, because the brain grows really, really rapidly in those first few years of life. As that brain is making more and more connections, those children are learning and they are absorbing everything like a sponge. And then what happens after that is, if you don't use it, you lose it. Basically, you keep those connections that allow you to stay alive, and you get rid of the ones that you don't need for that. So there's a pruning process that goes on, and you want that pruning process to be present, but you really want to prune out the connections that would make you be successful in life. Now, if you're growing up in a very stressful environment, you're going to prune more connections than you would otherwise, because elevated stress hormones will cause extra pruning of the brain, of brain connections. Also, if you are living in an environment where it is really important for you to be on your toes all the time and alert, and basically in sort of a fight-flight mode, because otherwise you might not come out alive, then you're going to prune connections in certain parts of the brain that, for another person who is growing up in a safe and secure environment, is those connections would not be helpful or necessary. So that explains this whole process of connections forming, and then the pruning process explains why young children who grow up in bilingual households will learn both languages without a problem, without an accent. But if you try to teach a 14-year-old a foreign language, it is much more difficult to make those connections. They're not there anymore. And so you have to kind of work hard to get them to form. And it's harder for that person to learn that foreign language without an accent and to pick it up as quickly. It also explains why children who experience a lot of trauma early in childhood will have pruned connections that might have kept them alive, might have caused them to be sort of on their toes, on alert all the time, but not allow them to sit and actually learn and pay attention in school as they need to down the line. So that's kind of what's happening in the brain. So next slide, please. Let's talk a little bit about what LENA START does. LENA START is a parent training program where it's a very strength-based program. It's not what is wrong, it is how can we support what is going well in the family and make it go even better. And it is typically done in group sessions with about 10 to 15 families. Childcare is provided if necessary. The parents meet one time per week I'm sorry, I didn't change that slide. It's no longer 13 weeks. It's been pared down to 10 weeks. And currently there are sessions available at brilliant Detroit houses throughout the city, as well as Kids Health Connections has been offering some in-person sessions at one of the recreation centers in South Detroit and at the Kemeny Recreation Center. And what is most important is that the parents collect a weekly recording using a little word pedometer, which I'm going to show you in a minute. Next slide, please. So this is the material that a parent will receive when they join. They get a bag, and it contains the parent guide. It contains books that the children's storybooks. There's some refrigerator magnets. There are these vests that you see in the upper right-hand corner, and the vest is made for whatever size that child is. And this is done with children 0 to approximately 2.5 years old. We want them to be less than 3 years of age, if at all possible, again, because of where the brain is at. And so they'll get a vest that fits their size, and then the vest has a little pocket in the front. And in that pocket is where the LENA recording device goes, which I have marked here with that green arrow. Next slide, please. So this is the LENA recording device, and think of it as a word pedometer. Parents are taught how to turn it on. It records up to 16 hours worth of the language home environment. And it is not a device that you can play back. So when it comes back to us, it's not like we can say, oh, somebody swore at the child. No, we can't tell what was actually said, but it is hooked up with into a software program. Black Family Development does that for us. And it spits out a report that gives us 3 different measurements. If you go to the next slide, please. Thank you. So it spits out a report that tells you how many words were spoken by an adult within 10 feet of the child. And you see that in the top of the blue bars on the right-hand side. And there's an hour-by-hour report there. It tells you, actually, I'm sorry, the words are at the bottom, I think, in the pink. The blue on the top is actually the conversational turns, the back and forth between an adult and a child, and that's what builds the brain. And so the goal of the program is to try and increase the number of conversational turn taking that happen. And it also gives you a report on the TV and electronic sounds that are out there, because TV and radio, et cetera, that's very passive, and it doesn't really force the child to pay attention. And so we discourage that as much as possible because it often is used as a babysitter for the kids, but it really doesn't do anything to build the brain. So parents will get this report. They bring in their device once a week. They get a new device for the next week. Only once a week do they have to make a recording. They get, when they bring in their device, they get the report from the week before. And over the course of the 10 weeks, then they can see from week to week how they are making improvements. And that's shown on the left-hand side here, where you can see the first week that was sort of the baseline. And then are they getting to where they want to be? If they meet a certain goal, they get a star, and it gets really funny because parents get quite competitive about, I didn't get my star. What do I need to do to get my star? But they can hopefully see an upswing in the amount of adult words as well as in the daily conversational turns. Next slide, please. Okay, I'm seeing actually the blue is the adult words and the yellow was the conversational turns. I was looking at the headings a little bit incorrectly. So over the course of the years, this is typically what will happen, from the first recording and to the average of the last 3 recordings, we see this kind of an improvement with adult word count going up into the 50 plus percentile, the conversational turn taking going up to the 24 points into almost the 50th percentile. I'm sorry, the word count went up into above 75th percentile. And for the lower talk families, the improvement is oftentimes even more impressive with adult word count going up by 53 points again, up above the 75th percentile, but they started out at a lower point, and the conversational turns also increasing by 24 points. Next slide, please. So this is found on the LENA website. If you go to lena.org, you will find this report, and this is a compilation of the impact that LENA Start has had across the country. This program is offered in many cities. In Rhode Island, for example, they've actually pushed it for the whole state. I know of one school district I'm going to show you a report on in a minute in Huntsville, Alabama, where the school district really pushed it for kids before the kids got to school. And they've seen some really impressive outcomes. And so step 1 is that LENA Start launches. A trusted local organization brings LENA Start to their community and begins recruiting families to participate in the program. Now in the Southeast Michigan area, the only organization that is offering this is Brilliant Detroit in conjunction with Black Family Development, and it is focused on Detroit proper. at Hamtramck and Highland Park is included in it too. We do not have it available in the Outwayne County area nor in the other counties, unfortunately. I keep hoping and bugging ISDs to consider somehow trying to figure out how to improve, make this available. So if there's anybody listening today who has ideas, it is a funding issue primarily, but the benefits are so tremendous that it is a worthwhile place to put your money. So nationally, there's been an increase, a 36th percentile gain in adult words, and that is looking at 5,001 families with a 72% graduation rate. Adults increase the interactive talk there's a 14 percentile gain in conversational turns and a 61% increase in parent-reported reading minutes, the amount of time that they spend reading to their children. Next slide, please. In Huntsville, Alabama, where, as I mentioned, the school superintendent decided this really was important and set up a system of recruiting parents into LENA START programs that were offered through the local schools. And so they now have an evaluation that came out in August of 2019 that showed that children whose parents participated in LENA START had much stronger literacy skills 2 years later. Next slide, please. The other thing that I really want to point out is that from a mental health point of view, LENA START is, there's data starting to come out now that shows that LENA START is also helpful. And the reason is that child vocabulary and social emotional competence are associated, and I have several references here. It's not clear how, but there's a reasonable hypothesis that children with better language skills can use language better to better understand and manage their behavior and their emotions. And so, next slide, please. This is a study that came out just in April of 2021 that showed that language and social emotional development in early childhood, particularly the role of conversational turn-taking, was clearly linked to improved social emotional development. So again, this is another argument for the LENA approach. Next slide, please. Now, LENA START is the program using the curriculum to try and train parents. There is also a program called LENA GROW, where child care workers are trained, and that's so that's LENA GROW. And in LENA GROW, this is the results of the link between training child care providers to do more talk with children and encourage more conversational turn taking. And you see improvements in all the domains that are measured on the Devereux Early Childhood Assessment, or the DECA, especially for those children who had previously experienced low talk environments. So I just want to point this slide out as being an important argument for trying to make this program available, not just for parents, but also for child care providers, and to encourage child care providers to do more to encourage conversational back and forth. And the one area I think that's really important is attachment and relationships, because that is such an important area to build resilience against trauma. All right, well, next slide, please. This is how one would get a child or a parent enrolled in LENA START in our Tri-County area. We have flyers available, and they are available on our website at khcmi.org. If you go to under what we do and you look for LENA START, you will find the enrollment sign up there. And there's a little video that the medical students at Wayne State University put together for us that describes LENA START, and then that underneath the YouTube, the video is posted on YouTube, and then underneath that is a sign up, but you can also find the sign up directly on our website. And it does say if your baby is 3 to 30 months old, if your child is 32 months old, it's okay to sign the child up. It doesn't need to be just 30 months old as a cutoff. And so you would sign up with Brilliant Detroit, and then their team and our team at Kids Health Connection work closely together to make sure that the program is offered in a place that is near to you. So that is all I have about the LENA Start. The next slide gives you, this is just the Brilliant Detroit website page that talks a little bit about it. They do this under their 313 Speaks program, but it is basically this program that I just described to you. And I am open for questions.
Thank you so much, Dr. Holtrop. That was really insightful. I especially enjoyed the science part of it, the synaptic responses, and how early literacy kind of connects those. So thank you for sharing that and sharing LENA Start with us. We do have a few more questions to go through, and please be sure if you're watching at home or at work that you're adding your questions to the chat. So the first question we have is, when parents or caregivers participating in LENA Start see that their conversations with children in their care are low, what are some ways that you could recommend to increase those?
Okay, so the curriculum actually goes over that, the 1 hour sessions that we do with the parents. And there are a number of different ways that parents are taught to increase the language richness. One of them is reading to the kid, or talking about, even if sometimes a parent's literacy might not be all that great, so it might be challenging for them to read. I can tell you, I had one mom who came to me years ago who clearly had issues with reading, and she had a 6-month-old child. And I said, you know what, doesn't matter. Put the baby on your lap and your arms around the baby. Here's a book. And it was basically a picture book with faces in different, sad, happy, whatever. And I said, talk about the pictures. Where's your nose? There's your nose. Where's the baby's nose? There's the baby's nose. And this mom, in spite of her literacy issues, came back to me at 9 months of age, when the baby was 9 months of age, and said, Dr. Holtrop, I need another book. We've been looking at this book every day, and he's getting bored. And so this was a mom who clearly had been using that information to try and share books with her child, even though she herself couldn't read. So talking is what's really important. One of the things that they train on in the LENA Start program is when you go to the grocery store, describing what you see as you go down the aisle, et cetera, et cetera, et cetera. So it's all different kinds of ways.
I love that. So giving, tangible advice on like how to really, build that literacy with your young child. We do have time for another question. So could you share with us a little bit more about Kids Health Connection and how your organization became involved with LENA Start?
Well, actually, okay. So Kids Health Connection's mission is to try and improve the medical home for practices that serve Medicaid enrolled children. And we are what's called a Children's Healthcare Access Program, or a CHAP. The original CHAP came out of Grand Rapids. We heard they did a 3-year demonstration project. We heard about the outcomes in terms of decreased emergency room visits, less hospitalizations, and increased access to preventive care services, and said we need something like that for Wayne County. And then through some generous funding from Kellogg and Kresge Foundations, we're able to start Wayne CHAP in 2012. And then in 2019, we're asked to take on Macomb and Oakland too, through the gracious support of United Way of Southeast Michigan. So that's when we clearly couldn't be called Wayne CHAP anymore, although that's still our legal name. So we're doing business as Kids Health Connections. And we linked up with primary care providers and really work hard on a number of different things. And we sat down with them and said, what do you need help with? And they needed help with getting kids in for asthma services, doing obesity, providing some sort of obesity service, hooking kids up for mental health service, and also getting kids in for well child visits. So that's what Kids Health Connections does. My push to doing something around literacy came really out of my experiences years ago, starting at Children's Hospital, where we were actually the first in the state to offer Reach Out and Read, which is a program to promote emerging literacy that primary care physicians do to try and encourage parents to read more by handing out an age-appropriate new book at every well child visit between 6 months of age and 5 years of age, and also talking about the importance to reading to them. So, you know, that was what got me started on this whole, oh, I got to address literacy, because if I address literacy, I will have a healthier child, because they'll be less likely to end up in the emergency room because they got involved with gangs or they got pregnant too early or whatever. They're more likely to stay in school and graduate and be successful adults. And then when I heard about LENA Start, it was like, oh my goodness, this is Reach Out and Read on steroids. And so it was, I had been trying to get this going. Black Family Development had reached out, wanted us to do something around asthma. And then I suggested LENA Start, and they ended up getting the first grant. And so that's how we got involved with all of this.
Wow. Yeah, that's an amazing story of partnership and just really, you know, looking at the health outcomes of children. So thank you so much, Dr. Holtrop, for all the work that you do and joining us today for our town hall. So that is all the time we have questions for today. I do have a few more updates to share with everyone before we close out today's event. As a reminder, for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like cooling centers, many of which are open this week. That's not right. It is wintertime. So if you are in need of any warming centers, actually, or any other resources, please feel free to log on to 211 or dial 211. And we'll also drop a link in the chat. And the link to that is unitedwaysem.org/211. Calling all Detroit Lions fans, you can help bring a win home for Detroit Lions and your community on December 4th. Cheer on the Lions as they take on Jacksonville Jaguars and support our work. Ticket sales benefit United Way for Southeastern Michigan programs to help families in our community. You can purchase tickets at unitedwaysem.org/Lions. Lastly, we'll be back in December with more What's the Word Wednesdays town halls. As a reminder, you can visit unitedwaysem.org/virtual town halls to stay updated on our upcoming topics and watch replays of previous town halls. That website is also included in the chat box. Thank you, everyone. We will see you soon. Stay safe and continue to light the way.